one pair of the vital organ situated in the abdominal cavity, so those are considered as kidneys. So the kidneys are very important and vital organ for each and every individual's leading a so that is healthy life. So here the kidney performs functions like a so eliminate waste or waste from the body and eliminates the waste chemicals from the body and maintains and regulates the blood pressure of the body. For that reason, it is considered as a vital organs of a human being. But so some of the diseases are there, so the conditions that can affect the kidney, so disturb the kidney functions. So though so in that, so the urolithiasis is also one. Urolithiasis. Now urolithiasis is easy. So urine is nothing but urinary system. So lithiasis is nothing but the formation of stones. Urolithiasis also we call as an urinary stones. Urinary stones. It means the urolithiasis means the formation of a so that is the stones anywhere in the urinary systems, either it may be kidney, ureter, bladder, and the so urethra. Okay, for that reason it is considered as the urolithiasis. Among the urolithiasis, the kidney stones or renal calculi is most common. Now, coming to the introduction about so this urolithiasis. Now, come to the incidence of this urolithiasis. For every year, so that is 106 million people were suffering from so this urolithiasis in the worldwide. Now coming to the so Indian incidence, 2 million people every year suffering from so this urolithiasis in India. Some of the areas are there in the so that is India. So for example, Maharashtra, so Gujarat, Punjab, Delhi. Okay, so those areas are considered as a stone belt because in this area only you are going to see a more number of cases they are suffering from so that is urolithiasis or kidney stones. Now coming to the definition of so this urolithiasis, a formation of a so that is stones in the urinary system is called as urolithiasis. Now coming to causes for the urolithiasis, most important. So the causes for the urolithiasis includes the first one is so dehydration is the most important cause for forming a so that is kidney stones. So that is dietary factors containing high rich so the calcium, auxiliary calcium phosphate the probably individual get it. So that is so kidney stones are urolithiasis. Some of the diseases are there are disorders that can the high risk to develop it, so that is kidney stones or urolithiasis. For example, so the Cushing syndrome. The individual who are having a Cushing syndrome, they will get definitely they will get a so that is kidney stones or urolithiasis. So certain medications are there. The persons who are suffering from some kind of a disease, they will take medication for treating so those conditions, but it is also the most important risk factor to develop it. So that is kidney stones. The genetic and family history also plays a very important role of forming this, so that is kidney stones. Because other than this, the smoking, alcoholism, so that is sedentary lifestyle or inactivity, the through physical activity. Okay, so these are also the important contributing factors to develop it, so that is urolithiasis or kidney stones. Accordingly, what are the clinical manifestations we are going to see in the persons who are suffering from kidney stones? The fever chills, abdominal pain, back pain, and the hematuria, dysuria. Okay, so all these important features we are going to see in the persons who are suffering from. So that is kidney stones and a false smelling of the urine also. Now coming to the diagnostic evaluations, how we are going to diagnose, how we are going to identify, so that is kidney stones. The USC's physical examination, the history taking is very important, and also the USG, the CT scan, MRI, all these are important. So that is the diagnostic measures are there to diagnose that. So that is kidney stones. Now coming to the complications. If you are not taking a proper care, initial stage only. If you are taking a care, initial stage only, completely can cure. But you are neglecting means that definitely can causes complications like you can damage the whole kidney also. It causes hydronephrosis. If you are not taking proper means it damages the kidney. That is kidney damage. Now coming to the management of urolithiasis. So medical management, in the medical management, so there is hydration is very important. The most important factor is dehydration. The management strategy is to dehydrate. Dehydrate. That is hydration. Yes, advising to take the more water. Now, surgical options. Almost all, so that is kidney stones that can eliminate through the urine if it measures less than 5 mm. The more than 5 mm, it needs surgical options or surgical procedures. The best and foremost surgical the treatment is lithotripsy. The crushing of stones by using a so that is laparoscope and ureteroscopy. According to this, so the nursing management for the persons who are suffering from the kidney stones. The role of nursing officer is very important, treating the persons having kidney stones or so that is urinary stones. So they encourage the patient to take more water because dehydration is the key factor to develop so that is urinary stones. And also the administer the drug as prescribed by the doctors, that is painkiller, non-steroidal anti-inflammatory drugs. And also some of the drugs are there, they can facilitate so the elimination of so that is kidney stones, administer those kind of drugs. And the psychological support of the patient is very important. And also coming to the health education to the patients is very important. Advice regarding to the diet factors and the physical activity and the cessation of the smoking, and also regular exercise, and also advice to take a regular medication as prescribed, and to advise to seek a medical aid if any discomfort is felt. Okay, so this is regarding the what the urolithiasis. Yeah, among the urolithiasis, so there is kidney stones, or so renal calculus is the most common form. Okay, right.